Very good morning all. Thanking you for giving me this opportunity. Today we are going to talk about the anatomy, that is introduction to anatomy. So I welcome everybody to the world of anatomy, and the introduction to the anatomy, we have to first bow to our father of medicine, Hippocrates, is 200 BC. And the word anatomy is derived from anatome. It's nothing but of a meaning cutting. Most of the words which are related to the anatomy, it is a terminology, it is mostly derived from the Latin and Greek. Anatomy, it's a Greek word. Anatome is the foundation. Anatomy is the foundation of the whole art of the medicine, which introduce the students to the greater part of the medical terminology. When you talk about the terminology, in 1998, they published a Federative Committee of Anatomy, a nomenclature which has a medical terminology to make assure that where the topography and where about talking, whether you understand clearly, everything has to be in the medical terminology. And this anatomy is subdivided and it has been studied in the different ways. Basically, we have two divisions. One is the subdivision of anatomy, which is a cadaveric anatomy. That is, whatever you see through the naked eye, and this is the one which gives a pleasure to enter the medical course. Being a student, so far you have studied everything, whatever you have read, but not seen everything. But here, whatever you are going to read, you are going to see in your naked eye. That is nothing but of a cadaveric anatomy. It's called as gross anatomy. That is cadaver, what we say, that is body, dead body, that we say here is a terminology. We start using cadaveric anatomy. The study on the dead bodies, usually with the naked eye, with the two approaches. One, we can approach region wise. Other one, we have a systemic anatomy. So let's start with the divisions. So as I told, there is a regional anatomy which includes head and neck, trunk, which includes thorax, abdomen. So abdomen we can divide into abdomen proper, pelvis and perineum, and of course we have a upper limb and lower limb. Systemic anatomy, you say skeletal system and muscular system, articular system, vascular system and nervous systems, so that you can study anything which is come under that topic. For example, we call it in the terminology, skeletal system is osteology, muscular system we call it myology, articular system is arthrology, and vascular system is angiology, and nervous system is neurology. And we also do the system in splanknology, that is you are going to read about the viscera, and that is respiratory system, digestive system, urogenital system, and endocrine system, and integumentary systems like skin and appendages. And also we divide the developmental of anatomy, that is called as embryology. It is nothing but of the study of human growth and development, which is prenatal and postnatal changes, which means that is before birth and after birth, And histology, it is a separate one. It's a microscopic anatomy. It's a study of structures with the aid of microscope. So you are going to study the structure with the help of microscopes by knowing the minute structures. and then follows the surface anatomy. It is a topographic anatomy which is very important for you in your life. When you are going for a practice, you have to touch the patient. For that you should know which is the deeper part of the body and what is related to it. So the surface anatomy is nothing but of the study of a deeper parts of the body in relation to the skin surface. It is the basis for the physical examination of the body for the diagnosis by the clinicians. Radiology anatomy, it is the study of the deeper structures of the body using the radiographical techniques, which is uses for your diagnosis and also uses for the treatment of the disease. And of course we have a comparative anatomy, which basically you won't go for the depth, but you should have a knowledge that is an anatomy which explains the change in the form and structure and functions of a different parts and compared to the other animals, mammals and things. And which all these things which is useful for you being a medical student, you have to apply this knowledge to the clinical practice. So that's why we call this applied anatomy, which is very important to our curriculum. So we describe to you the terms. Before going to the procedures, we have to know we have two type of positions, what we call as anatomical position. One is supine position and another is prone position. So anatomical, when you know about these two positions, we have to confirm it with that, and then we divide the body into the planes so that in where you are. So that anatomical planes we have different. One is a median plane, another is a sagittal plane, and a coronal plane, an horizontal plane, and oblique plane. I'll just give a few example, or I'll just help you how to differentiate that median plane. So median plane is nothing but a mid-sagittal. That means it divides the body, make just half right into left of the body. Imagine that you are cutting the body into the right half and the left half. So that is called as the enunciation called as median or a mid-sagittal. Then what is called a sagittal plane? That is, any plane which is parallel to the median plane is called a sagittal plane, and coronal plane is a vertical plane at right angle to the sagittal plane, and of course you all know what is the horizontal plane and oblique plane. So the terms which we are going to use here, generally we say it is in the front or in the back or in the above or in the below. This is what we were using till now, but now in the medical course when you entered, you have to use the terms which is very important. For example, if you say it is towards your front, that means hereafter you have to use the term anterior, it's towards the front. Then posterior is towards the back, and superior is towards the head, and inferior towards the feet. Then what is about the medial and lateral? Medial is nothing but towards your median plane. So that we already discussed what is median plane. That is, towards the median plane is the medial, and when it is away from the median plane, it is called as lateral. But as I told before, anterior and posterior is nothing but of towards the front and towards the back. Whereas we call it, if it is embryology, we call ventral, the same towards the front. Whereas in the posterior, we here call it dorsal, that is towards the back. And we say cranial or the rostral, that is towards the head. Where we used there, it is superior. And here we say cranial or rostral. And caudal, it is nothing but of towards the tail, that is we say inferior. Like here we are using caudal. And what is called as proximal and distal. The proximal is nearer to the trunk and distal is away from the trunk. So other terminology, like for example, you say in the upper limb, radial, that is outer border in the upper limb, whereas ulnar is the inner border in the upper limb. The same way you can use it in the lower limb, that is tibial, the inner border in the lower limb, and fibular, that is outer border of the lower limb. So all these things are terms where you are, where is the border, how does that. And we say in the limb, flexor surface, there are the surface what you have to know is called as flexor surfaces and extensor surface and palmar surface and dorsal surfaces. We'll come to it each one everything in detail. So other terms also we use superficial, that is towards the surface, and deep is inner to the surface, and exterior it's outside and interior is inside. If it is the same side, that is called as ipsilateral. If it is opposite side, we call it contralateral, and if it is bilateral, we call it as a both sides, that is bilateral. So the term used for describing the movements, as I told, we have to know the bending and forward position, everything. We use some particular terms which is very important. What is called as flexion? Flexion is nothing but a flexor surface approximation and the angle of the joint is reduced. And what is called as extension? It is nothing but of the opposite action. And there is another movement called as adduction, and we have abduction, and there is a medial rotation, and there is a lateral rotation, and there is called as circumduction, pronation, supination, protraction, retraction, inversion, eversion, dorsiflexion, and plantar flexion. These are the terms we generally used. We have to go through all these things individually. So what we do all these things, why we are doing all these things, why we give terms? Because with all these things we have to apply to the clinical knowledge. So that is called as applied anatomy or a clinical anatomy. When you call for example a term called as inflammation, that you know already, your stomach has got inflated, or a liver has got inflated, or your appendix has got inflated. So that is called as inflammation. So what we generally do in the medical terminology, we added itis, that is itis. If it is come in the end, then we call that particular organ is got inflamed, that is inflammation. So we call it gastritis, or we say appendicitis or hepatitis. See, for example, you do a surgery in the uterus, right? So for that we have to put a hole and see what is that. That is called as otomy. For example, you can use that open, otherwise called as otomy, that is called as laparotomy or hysterotomy. Then what is called as ostomy? You just include an S if it is, the totally it is changes. That is open hollow organs. For example, a trachea, you have to put a hollow, that is a hollow organ, right? So when you put that we say tracheostomy. Or any growth in the body we called as tumor. You know everybody what is tumor? It's nothing but of a growth, which is abnormal growth in the body of any place. So we call this, the end will be oma. So tumor we say lipoma. It is nothing but of a lipid accumulation, so it grows out. Then carcinoma, it is the cancer, what we call as CA. It could be anywhere. And symptoms is nothing but a complaints of the patients. The patient comes with you and says, I have headache, I have fever, I have vomiting. All these things are only the symptoms but not disease. Many symptoms join together and say it is a syndrome. So the symptom is completely different. With the symptoms and complaints of the patients and with the other diagnostic tools, we come for the diagnosis. That is nothing but what we call as the identification of the diseases. So clinical anatomy, you should understand that. And some terms I like to give, for example, which already you know, what is puberty? That is the age at which a secondary sexual characters which develops. You know all that develops 12 to 15 years in girls and 13 to 16 years in boys. And everybody used to have fever, so that we year after used to use the term is called as pyrexia. And any injury, it called lesion, and any swelling, it is called as edema, and any intravascular coagulation of the blood, that is called as thrombosis, or any bleeding, it is an hemorrhage, or any ulcer in the skin, that is localized erosion of the skin, that is called as ulcer, or in the same place, if it is a death of tissues, is called as necrosis, and if there is a loss of movement of the body, then we call it as paralysis. And if there is a loss of touch in the sensibility, that is called as anesthesia, and where is the loss of pain of sensibility is called analgesia. So from all these things we understand one thing, that anatomy is the study of the structure of the body and the relationship of its constituent part to the each other. So generally we have studied a gross anatomy and regional anatomy. I try to tried my level best for you to give what are the terms and how much it is useful for this. Hope you all enjoyed the journey of the anatomy, which has taken you to the new world of anatomy. And this terminology, everything is going to hereafter will be traveling with this terminology, and the total anatomy is going to be in your full life. As I always say to the students, that without ABCD there is no English, like that without anatomy there is no medicine. So I request all the students to get familiar with this anatomical terminology so that you won't have any phobia of this medicine. So when you hereafter you try to practice using this medical terminology and terms, and so that when you study or any sections or anything, you just try to use and get familiar with the terms so that it will be easy for your future in medicines. Thank you very much for giving me this opportunity.